Good morning, everyone, and welcome. Today, we'll be diving into a comprehensive overview of drug pharmacology and substance use disorders. We'll explore how drugs enter the body, their effects on behavior, the development of dependence, methods of diagnosis, and various factors that influence these processes. I'm excited to take you through this important and complex topic. Let's get started. When drugs enter the body, they can do so through several different pathways, each with its own characteristics. First, we have oral ingestion, where drugs are swallowed and absorbed primarily through the digestive tract. This is one of the most common methods and works well for many medications, though absorption can be slower compared to other methods. Then, there's inhalation, where substances are delivered directly to the lungs. This allows the drugs to enter the bloodstream very quickly, providing rapid effects. Injection is another pathway, where drugs are introduced straight into the bloodstream, muscles, or tissues. This method is fast and efficient, often used in medical settings for immediate action. Lastly, we have topical absorption, which occurs through the skin or mucous membranes. While absorption through these routes can be slower, it's useful for localized treatment. When it comes to drug exit, most substances are metabolized in the liver and then eliminated through the kidneys via urine, the lungs through exhalation, or even sweat glands. Understanding these pathways helps us grasp how drugs work and are processed in the body. When we look at how a drug behaves in the body, several factors come into play. First, dosage is crucial because it determines the strength or intensity of the drug's effect. Taking too little might not achieve the desired outcome, while too much could cause adverse effects. Next, the metabolism rate, mainly controlled by liver enzymes, influences how quickly a drug is broken down and eliminated. This means some people process drugs faster or slower, affecting how long the drug stays active. Another important factor is the route of administration. For example, injections usually deliver the drug faster into the bloodstream compared to oral intake, which affects how quickly the drug starts to work. Body weight and composition also matter, since fat and muscle tissues absorb drugs differently, affecting distribution throughout the body. Finally, drug interactions are key. Combining medications can either boost or reduce their effects, which can change how effective the treatment is or increase the risk of side effects and toxicity. All these factors together help us understand why drugs may act differently from one person to another. When we talk about dependence on drugs, it's important to understand that there are two main types: psychological and physical. Psychological dependence involves a strong emotional or mental attachment to the drug. People experience intense cravings and feel compelled to use the drug repeatedly, even if it causes harm or negative consequences in their lives. On the other hand, physical dependence is all about how the body reacts when the drug is no longer present. This shows up as withdrawal symptoms like sweating, shaking, nausea, or anxiety. These symptoms happen because the body has adapted to the drug's presence and struggles to function normally without it. Both types of dependence are critical to recognize when addressing drug addiction and recovery. The DSM-5 provides a clear framework for defining substance use disorders by listing specific criteria that help clinicians identify and diagnose these conditions. One key aspect is the development of tolerance, which means that over time, a person needs to consume more of the substance to achieve the same effect they once did. Another important factor is experiencing withdrawal symptoms when the substance is not used, indicating physical dependence. The diagnosis of a substance use disorder is then determined by assessing how many of these criteria are present and the severity of the symptoms over a certain period. This approach helps ensure a more accurate and consistent understanding of the disorder. When we look at substance abuse from different theoretical perspectives, we get a more comprehensive understanding of why it happens. First, the psychological perspective draws our attention to personality traits like impulsivity that can make someone more likely to use drugs. It also considers how behaviors can be reinforced through conditioning, meaning repeated drug use becomes a learned habit. Next, the sociological perspective reminds us that external factors play a big role. Things like peer pressure, socioeconomic status, and cultural norms all influence how and why people might start or continue using substances. Finally, the biological perspective focuses on what's happening in the brain and genetics. Certain genetic predispositions and brain function abnormalities, especially in areas related to reward and self-control, can increase a person's vulnerability to substance abuse. Together, these perspectives help paint a full picture of the complex factors involved. When we look at risk factors that increase the likelihood of drug use, there are a few key points to keep in mind. Having a family history of substance abuse can significantly raise the chances someone might start using drugs. Starting drug use at an early age also increases vulnerability, as does experiencing high levels of stress. Additionally, people who have co-occurring mental health disorders often face a higher risk of turning to substances as a way to cope. On the other hand, protective factors play a crucial role in reducing these risks and building resilience. Strong family bonds provide essential emotional support that can help individuals resist drug use. Being connected with positive peers also discourages experimentation with drugs. Developing effective coping skills is important because it allows people to handle life's challenges in healthy ways. Lastly, having access to quality education and healthcare not only raises awareness about the dangers of drug use, but also ensures that treatment options are available when needed. Together, these protective factors can create a strong foundation for prevention and recovery.